Good morning, good afternoon, welcome. A very, very warm welcome here from ISNTD, the International Society for Neglected Tropical Diseases, to all who are tuning in and joining us for our ISNTD Festival event. It's the 8th annual such festival where we bring together all things creative and communications and bring that together with tropical diseases to explore and learn and just enjoy really all of the many and varied creative approaches to these complex diseases that have been appearing all from partners and organizations all around the globe. Always a very exciting event. We do really enjoy it here at ISNTD. It's amazing to discover all the fantastic advocacy, communications, autistic work that's going on in this field around the world. And so really pleased to be here today. For over the next 2 days, we're going to really discover and learn from some very varied projects and organizations, whether that be to hear a bit more about how to communicate about these diseases, how to take the local stories over to a global stage, a global advocacy arena, whether it be to learn a bit more about the role of journalists in speaking about science and neglected tropical diseases, but also what can journalists do for scientists. We'll learn and see examples on data visualization and how a beautiful illustration can tell 1,000 words. And tomorrow, for our next day, we'll also have a chance to quite simply enjoy some wonderful podcasts around infectious diseases and also some great films that have come out over the last year on diseases as varied as Chagas, schistosomiasis, and also just more generally about women working in neglected tropical diseases. Throw in a few comics into that as well, and just artwork, medical illustrations and animations, and we've got a really packed and exciting program ready for the next 2 days. So thank you so much for joining us. Welcome. And without any further delay, it's my pleasure to welcome our first 3 speakers for this event, who are going to set the scene for us and bring us up to date on some of the most exciting campaigns and movements that have been occurring in communications for neglected tropical diseases. And so I'm sure you will join me to welcome very warmly our first speakers for this day. First, we'll hear from Theresa Baird. Welcome, Theresa.
Hello, Marianne. Hi.
Thank you so much for joining us. Theresa, you're a Senior Programs Officer at CBM Global Disability Inclusion, and you'll be talking to us about ANAS's story, or how to take a local story and share it to a broad audience. And thank you for being with us. Following that, we will, it's my pleasure to welcome Claire Jeantet. Hello, Claire.
Marianne. Hello, everyone.
Welcome, Claire. You are a filmmaker. I will introduce you, but I think many of us don't need an introduction. You have been one of the faces of the Noma campaign over the last few years. You made a film on Noma and really followed and accompanied this disease in its incredible advocacy journey from, again, a story all the way to being officially ratified as a neglected tropical disease just a few months ago in December 2023. So we are looking forward to hearing your journey and also your insights into what that has meant. And after your presentation, we'll hear from another immense success story in neglected tropical disease advocacy and communications, and that is the World NTD Day, now in its 5th year. Not just a World Day, but a really exciting global movement that draws together a huge range and types of creative approaches. So from the more classic slogans and campaigns all the way to lighting up buildings, a dance and a song this year even. So lots of really fantastic, exciting ways to take the sometimes very complex science all the way to a broad audience. And without any further delay, another warm welcome to our attendees. And we've got Rabiu Ibrahim tuning in from Nigeria. Welcome, Alphonse Renz. Lovely to see you here. Alphonse was a speaker at our inaugural festival back in 2017 at the Barbican. Nice to see you. Helena Uliartha, Jerry Atsi, Edith Nalwada from Uganda. Welcome, everyone. Please don't hesitate to jump into the chat and say hello, where you're tuning in from, and your organization. And without any further delay, let's open the festival. Let's start with our very first session, which is all about communicating about neglected diseases, from local challenges to global advocacy. And Theresa, I'll hand over the floor to you. Thank you so much.
Thank you so much, Marianne. Thank you. Start presentation, or yeah, there we go. Super. Thank you. Well, really, I am so thrilled to be here at the opening in the ISNTD Festival 2024. CBM Global Disability Inclusion and our partner HANDS, I believe Jerry is online and others maybe too, and all those around the world have been really inspired by so many of the creative endeavours of our peers in the NTD sector, and we really, really welcome the opportunity to contribute today. So I'd like to share with you the story of Anis. It's a person-centered, country-led storytelling from our Chiscola programme. Really, it's a story of renewed hope for this young man. He's only 19, who has already experienced the devastating and stigmatising impact of bilateral lymphedema caused by the mosquito-transmitted skin NTD lymphatic filariasis. Slides. What really stands out with his story, though, when I show the film in a while, is that the treatment alone isn't enough for those who are still living with the disease, and there is a critical need for ongoing morbidity management, access to water for washing wounds, such as this lady here, just the health worker just helping her to learn herself, and for the health worker was in a training session on how to actually manage the wounds. And they need access for water for washing wounds every day. And they need mental health care with peer support and stigma reduction in the community. And there's a need to support, or at the very least, to facilitate access to disability inclusive livelihoods. So these are the components of the holistic approach in the Chiscola project model. The Chiscola is a project created with CBM Global Disability Inclusion and with HANDS Health and Development Support in Jigawa State in Nigeria. And its key element to it really was that it was co-created with persons affected by NTDs in that area, in that local context. It's always best, obviously, to hear the voices of persons affected by NTDs firsthand. You can hear some great conversations out in the field, but it's not always possible to take leaders out there. And so sharing Anis's story of renewed hope has really encouraged local leaders and state actors to support these mental health and peer support groups and to understand about the need for the stigma reduction in the communities, to ensure that their ministries are collaborating to ensure inclusive WASH activities, to work with existing livelihoods operators, particularly disability inclusive ones in the area, and to build up those partnerships. And in our case for this project was training WASH artisans to rehabilitate the water boreholes so that communities had access to water and people with wounds could get the water they needed for their wound care. And really, Anis's story that I'm going to show you has helped in removing barriers to inclusion, the societal stigma and discrimination at community level, but also enabling this reintegration and acceptance of a person as being of value to their community and of their self-acceptance as well. But also reinforcing interests of the state and national governments and developing partners in these disease management and disability inclusive interventions that I'm talked about. And ultimately providing direction on the journey to NTD elimination. So the film I'm about to share really has been shared even more widely. It's been we're hearing the voice of Anas at international advocacy events. So Dr. Julian Eaton of CBM Global Disability Inclusion, he presented at the Africa CDC conference on the mental health stigma and NTDs. And Kirsty Smith here, our CEO from CBM UK, took Anas's film to the UK Parliament, which was very exciting for us. For an event talking about building resilient futures to leave no one's left behind, harnessing UK leadership in disability inclusive development. So his story's really gone global. So now I invite Marianne to share the film for you, and then I'll come back and tell you a little bit more.
In the heart of Jigawa State, Nigeria, lies a story of resilience, determination, and community support.
Ina makarantar allo a Kano, wannan abin ya same ni. A lokacin da na zo gida, an ɗauka irin ƙiban nan ce haka ta samun hutu, to ashe ba ita bace ba, har sai da wata rana na rauni. Raunin ya zama min zazzaɓi. A lokacin da na tashi ko iya takawa ba na yi da ƙafata.
Bayan shekara 5 kenan abin ya faru da shi. To shi ne da ya zo shi haka dai mun gan shi haka dai da ƙibarsa mun ɗauka haka, ƙiba ce haka, to a rashin lafiya ne farkon shiga shi. Sai haɗu da zazzaɓi. Sai babansu ya ɗauke shi kai kemis, sai aka yi mar ƙarin ruwa. To tun daga wannan ƙarin ruwa shi kenan.
Bana yawan shiga cikin mutane saboda wasu suna kallo na ko kuma wasu suna tsoro na. Amma haka wani bako ko zan je wani gurin, in dai an gani wasu suna nuna ni, wasu kuma suna gudu saboda sun gani. Gaskiya hakan ina jin ba daɗi sosai.
Akwai ƙanwata da take aikin asibiti, shi ne ta sanar da mu akan lallai ana neman mu a birnin kudu mu je, to muka muka je, to shine fa muke ganin sauƙin abin a kayansa da rayuwar can kan da ne yanzu gaskiya ba ɗaya bane. Ai Allah.
This is the tale of Anas, a beneficiary of the Jigawa State Comprehensive and Inclusive NTDs project, Chiskula.
Sunana Anas Iliya, shekaru na 19. Ina ɗaya daga cikin wanda muka ci moriyar Chiskula.
Anas is unfortunately among the many who have consistently missed out on the World NTD over the years. And so when the Chiskula project was rolled out, Anas was identified and brought in as the person affected by NTDs. Anas is a very hard-working young man and also a very happy soul. He has bilateral lymphedema, but this has not kept him down. It has not deterred him from wanting to make something out of his life and also to contribute to the development of his community. Anas has benefited so far from the livelihood component of the Chiskula project and also from the WASH component of the Chiskula project. You could see how he was eager to learn what they were being taught, and after the training, he immediately set out to see how he could fix the broken down boreholes in his community. And I'm sure that this has offered relief to his community and also helped him to be reintegrated into the community and restored his hope at having a normal life.
An masa horo ya koya kuma Allah da ikonsa ya iya. Akwai tuƙa-tuƙanmu ya kai guda 10, daga ciki mun samu 6 ma sun lalace, jama'a suna shan wahala ta ruwa. To Anas ya je masa complaint, ya je ya gyara mana, jama'a suna ta godiya, to mun yi godiya akan wannan. Kuma baya da haka Anas da jama'a suna kyamarsa. Yanzu kuma sun ga abin ba ma abu ne na kyama ba, har gurinsa suke zuwa, daga ciki ma yanzu har sallama yana jan jama'a, kuma gona ma in ya tafi tare suke tafiya da jama'a.
Wannan tallafi da Anas ya samu ya canza rayuwarsa ta yi kyau. Abin da zai yi wanda da yakan baya more kansa zai iya amfana kansa. Wato alhamdulillah na gode wannan kungiya da ta tallafa wa Anas. Na gode Allah saka mata da alkhairi.
Gaskiya na ji daɗin shirin Chiskula saboda sun ɗauke ni da muhimmanci, sun dawo min da rayuwa na sabo gaskiya sosai, ba kamar yadda nake yin ta kafin na same su ba.
Anas's journey from adversity to empowerment has transformed not only his life but the lives of everyone around him, and it is evident that the Chiskola project has brought hope where it was once scarce. This project is supported by CBM Global Disability Inclusion and implemented by Health and Development Support Program HANDS in collaboration with the Jigawa State Government.
Thank you so much for sharing there, and thank you to Jerry and Maureen and Philip O'Day, all of the team at HANDS and at CBM Nigeria for creating that film. I just want to really share with you now, Anas's story continues to inspire us. So I'm just so excited that this journal, he features on the front cover of the special supplement on mental health, stigma and neglected tropical diseases, where all of the different researchers in this field have all come together into one supplement, and I'll share the links in the chat after the presentation. There's a launch event for this tomorrow, and you can join remotely here for free between 5 and 6 o'clock London time tomorrow. So just Anas continues to inspire everybody, and yeah, we really would love you to come and join us tomorrow and to continue with your work in ensuring that the voices of people affected by NTDs are really heard from that local level right through to international and beyond, you know, to the global world there. So thank you so much, Marianne, for inviting us today to share. Thank you.
Thank you so much, Theresa, for this great presentation. I think you used a really important word there, which was co-created, and something that will come up a lot as we work through this festival and look at a lot of the material in whatever format and form it may be. Also really interesting to watch that film, and the really bringing the story of the individual to a wider audience is certainly a movement, a trend that's being seen, and perhaps later on, if in our discussion we can come back a little bit to that, whether it be around putting a treatment in context or an intervention or a mental health support, lots of different ways in which the personal story really impacts that. So thank you so much for setting the tone for our event. I'll hand over now to Claire Jeantet. Claire, filmmaker with Inediz, former MSF Noma campaign manager as well, and really someone who's been all along at every stage of this really immense journey around Noma over the last few years. So without any further delay, I'll hand over to you, Claire. Thank you so much for being with us and sharing some insights into what has made, as you say, from a visual challenge to a global campaign, the Noma success story. Thank you, Claire.
Thank you very much, Marianne, and thank you everyone for joining today. I'm going to start exactly, I mean, from where I started 8 years ago when I first heard about Noma. Yeah, this is a project that I have done with my business partner at Inediz, Fabrice Caterini. So I'm going to often say we, and it means Fabrice and myself. So we started this project in 2016, and we had never heard about Noma. It was some colleagues at Doctors Without Borders, MSF, who told us about it, and we were surprised as journalists and filmmakers that we had never heard about this. And obviously, we started by Googling the disease, and there were only few publications about the topic, very graphic medical pictures, Noma is a gangrene affecting the face. So it was really a challenge at first to understand how we could tell this story from a visual perspective, and our idea was to do a documentary to document the journey of people affected by the disease. But this was a long journey, and I'm going to explain some of the key points of this journey, and showing how we started from this visual challenge of picturing the disease to what has evolved afterward in a very organic global campaign asking for the disease to be recognized as a neglected tropical disease, and most importantly ended up with a movement led by people affected asking for their voice to be heard. And I'm going to start with this picture of Aliu, who is one of the first survivors we met in Nigeria and visited several times in his village. And when we started this project, we had many questions. We wanted to see how we can picture the challenges faced by people affected and people who had their face affected by the disease, who had lost their face, which is our first mean to connect with each other. So some people like Aliu were hiding their face, and at the other end of the spectrum, it looked like some people, the potential decision maker, global health experts, were looking away. So we were trying to find a way to tell the story and to understand how to picture a disease with such terrible consequences. And a lot of the challenges related to telling the story of Noma are really inherent to the disease itself. First, there was the fact that 90% of the people affected are estimated to die in just a few weeks. So basically, they are not even making it to the statistics, and we soon realized that even scientists had more questions than answer about what is Noma, how it starts and how it evolves, and why some people are affected and not others, etc. So there was a lot of question marks, and we understood that it will be a difficult topic. And another challenge from a visual perspective was the fact that the disease, it starts between two teeth, like gingivitis, and the presentation of the disease is really different from one patient to the other. You can see here some drawings done by a French artist called Chloé Fournier. And it really shows that each patient is presenting with a different with different wounds, and this was also making it difficult to really show from a visual perspective that it was the same disease but producing very different results. Also, something important to mention is that because Noma mainly affects children, the wounds are evolving over time, and therefore it was also another challenge to see that it mainly affects children, but some of the survivors were also adolescents or adults with very different presentations of the disease. I want to make a stop here just to speak about one of the very first patients that we met, who is called Soufianou. And this patient really made a huge difference in the way we approached the topic. When we met him in 2016, Soufianou was almost dying of Noma. Doctors had very little hope that he would survive. And when we asked his father and mother to take some pictures, his father really insisted that we should share the picture with him. And of course, we were trying to get enlightened consent from patients and people we were photographing. So asking them to sign those consent forms that you know about. But the father of Soufiano was very specific that he wanted the picture, the print pictures. So we weren't really sure about how to achieve this, but it was an important part of the project, which started because we told him that we will find a way to bring back the picture to him, and this started the collaborative part of the project, which was really every time we were coming back to Northwest Nigeria, we were bringing back some print pictures and sharing it with the people we had photographed. So this is just to show you where the hospital where we filmed and photographed people was located in Northwest Nigeria, in Sokoto. And this is also the opportunity to speak about another challenge related to this project, which was the fact that patients were coming from all over Nigeria, speaking different languages, and we were never sure about which patient we're going to see from one filming trip to the other. So this was also a challenge. This is a picture of Amina, who is one of the people we filmed over the process. And with her, we understand another challenge, which was the fact that people were indeed coming from all over Nigeria. Amina was based in was living in an IDP camp in the northeast of the country. And when she first arrived, we met her the very first day she arrived at the hospital. She had never seen other people living with the consequences of Noma. And we understood with her, I mean, what happened when patients were connecting to each other and realizing that it wasn't a curse, but it was an actual disease and that something can be done about it. Here is a picture of Balkisu. On the left side of the screen, she's a picture during a medical screening at the hospital. So this happened every time patients were showing up for the round of surgery organized by the Ministry of Health and Doctors Without Borders. So you can see her before surgery here, and on the right side, she's holding her own picture. So we had kept this idea of bringing back print pictures to people. And you can see also on this picture, not only the surgical process, but the holistic approach at the hospital really changed people. She had gained weight, gained confidence over time. And at this point, we were really creating connection, a genuine connection with people, building a relationship, always asking again for their consent, for us to share those pictures with the world. And this was a picture that we shared with her at this time. And this is Soufiano again, a year later. So he had survived, he had gained weight. And at this point, we were able to share with his father, to fulfill our promise and to share with his father the picture we had taken during our first visit. And it was really the confirmation that the collaborative process with people was the way forward. To give you an idea, we spent about 100 days in Sokoto, and we were only filming like 1 hour every day. The rest of the time we were sitting with people, learning a bit of Hausa, and really building relationships and trying to understand their own perspective on what was happening to them. In 2018, this is all we ended up showing our documentary, Restoring Dignity to the People we had filmed for the first time. This was quite unique as filmmakers, that we were able to share the final product with them once again, to ensure that they were really happy with the way we picture their story, and that they were on board with us sharing this with the world. Once again, coming back to the question of consent, and really making sure that they had clearly understood what we wanted to show to the world in order to raise awareness. And yeah, they gave us the permission at this time to share the film beyond. And this is Sakina and her mum that you can see on this film poster. From there, we started a quite organic campaign and alternative distribution campaign, I should say, because most of our clients, media, were not really, I mean, they really liked the film, but they were not really ready to show it with their audience. They had concern about the fact that we were speaking about topic like malnutrition, and that people were disfigured, and they were concerned about the fact that their audience might be shocked by the topic. So this is one of the first event which was organized. The international premiere of the film happened in Dakar, Senegal, which is another country which is part of the regional Noma control program of WHO. And this is where we understood that having a direct connection with viewer would really make a difference, because every time we started showing the film, there were people in the room who wanted to show the film to their communities, to in their universities, in their hospitals, in their own networks. And this is all we understood, that there was interest from the people, and that something can be done about it. And this is when also we took a step back, and obviously we had started this project in Nigeria, but we knew that WHO had this regional program, and so that Noma was not only in Nigeria, but in different countries across Africa, and we started screening the film in this context, but taking another step back and trying to reflect on how to involve more people, more stakeholders. We realized that Noma was really a global issue. You can see here a map, and this is coming from literature review published by The Lancet. I will share the link, and you can see that Noma was documented all over the world since 1950, at least in 103 countries, according to this study. So we really realized that Noma was a global issue, and that the film and the topic can interest people beyond the countries directly affected nowadays. And on the same note, it was also important to take a step back from an historical perspective, realizing that Noma had existed and was reported all over the world through history. You can see here some pictures showing Noma in different contexts. last time cases. It used to be a common cause of mortality in Europe, for example, and the last cases were reported during World War II in Nazi concentration camps. This is a drawing you can see here from 1946. And at this time, it was always in the air that Noma was fitting all the criteria to be recognized as a neglected tropical disease, but we had never really thought about the best way to move forward on this. And I started collaborating with Doctors Without Borders, trying to build the case for Noma to be recognized by WHO as a neglected tropical disease, considering that it was fitting all the four criteria to be recognized. At this time, something that also made a difference is that we had produced a short film, which obviously was easier to spread our messaging on the disease and explain what the disease was. It's called Surviving Noma. It was selected for the inaugural Health for All Festival by WHO, and this helped a lot in getting more and more interest. At the same time, we had organized with ISNTD and several partners the first international Noma conference, understanding also that there was an appetite from the scientific community and global health community to really share knowledge, know more about the disease, and reflect together on solutions. There was also at this time a historic opportunity, which was the Oral Health Resolution adopted at the World Health Assembly, which really put a political or highlighted the political will to include Noma in the NTD roadmap. So this really made another difference. At the same time, survivors were taking part in the different events that we were organizing all over the world. The film was screened in about 30 countries and dozens of online events. And survivors who had been first invited to speak and answer the audience question after the film decided in December 2022 to create their own association, the very first Noma Survivor Association. So it was co-founded by Molekat Okanlawan, that you can see on the right, which who is one of the person that we had follow in our documentary, and Fidel Straub on the left, who is based in Switzerland. At this time, the Noma community and with the leadership of Nigeria has developed a dossier of evidence making the case for Noma to be recognized as a neglected tropical disease. And once again, more and more countries got involved. At the end, this is 31 member states who supported Nigeria request, and really showing a global interest for the topic and the need to address this issue. At the same time, as a result of all those efforts, we started to gain more and more interest from media. And this is in December 2023 that Noma was finally officially recognized by WHO as a neglected tropical disease. And I want to finish by a picture of Soufianou again. Fabrice, my business partner at Inediz, had the opportunity to go back to Nigeria last year and met again with people we had filmed photograph. And so Soufianou is now 9 years old. And his father, who inspired this collaborative aspect of the project, is still carrying around those print pictures that we had shared with him and that he allowed us to take at this time. And yeah, Fabrice was able to meet again with some people who 6 years later confirmed again their consent and their will to contribute to this global campaign. Finally, just a picture of some of the people who contributed to the project. It was always a collaborative effort. Many people have been supported this project over time, and it's really an honor that we were able to collaborate with them. Thank you very much.
Wow, thank you so much, Claire. What an amazing slide to finish off on this constellation of portraits, and really permeates what you've been saying throughout your presentation, starting with images and finishing with images. And it's been really important that you've told us a lot about consent and involvement of affected persons and their communities into your work, into any images, into any communicating about the disease that affects and is a burden on the communities. So very important reminders. Thank you. And I'm sure we'll delve a little more into that as we continue with our discussions, and perhaps some questions from the audience. If anyone would like to ask something, or maybe has a comment or some feedback, or maybe you'd like to share your own work in storytelling, in communicating about diseases or public health, global health generally, please put it in the chat. But before that, thank you, Claire, and we look forward to asking you a few questions in a few moments. And before we do that, so Noma became officially a neglected tropical disease a few months ago, rejoins kind of a whole family of neglected tropical diseases, which I'm sure most everyone on this call knows are such a diverse, very different, eclectic group of diseases. And well, how does one communicate about such a really very diverse topic? Our first inaugural ISNTD Festival, which was in 2017 at the Barbican Centre here in London, marking the 5-year anniversary of the London Declaration on NTDs, Professor David Molyneux, Professor Emeritus from the Liverpool School of Tropical Medicine, talked to us about the NTD brand and some of the ways in which to talk about NTDs as a cohesive unit. And a few years later, the World NTD Day was born, really taking this unified message to a very global audience in a huge, varied amount of different ways and formats. And so it's my pleasure today to welcome 3 speakers who have been instrumental in creating, building, sharing, amplifying, and magnifying this amazing World Day. Please do join me in welcoming very warmly, to talk to us a bit more about this movement, our 3 next speakers. So I'd love to welcome Louise Tribe. Louise, hello. Thanks for joining us.
Hello, thank you so much.
Thanks for being here. You're Director of Communications and Partnerships at Uniting to Combat NTDs. I'm sure that many of us have had exchanges with you. Thank you for being here. We also have joining us from the Global Institute for Disease Elimination based in Abu Dhabi, Priya Kanesan. Welcome, Priya.
Thank you. Pleasure to be here.
Hi, and you're Director of Advocacy and Communications at Glide. And very happy and excited to also welcome Derek Mpofu. Derek, you are a musical artist, and you're going to tell us all about a extremely catchy song, which I'm sure many of us heard at the time of the World NTD Day back in January, and maybe some of our audience even partaked in a dance that accompanies this. So we'll be hearing all about that in a few minutes. So it's my pleasure to hand over to you, our speakers, and thank you for sharing your insights with us.
Thank you very much.
Thank you, Marianne, and thank you for having us all here today to talk to you a little bit about World NTD Day. And it's really a pleasure to be here. Perfect. So just as Marianne already did the introductions, but I'm Priya, and I lead advocacy and communications for GLIDE, which is a relatively new entity in the world of neglected tropical diseases, launched at the end of 2019, but really working in partnership to help accelerate elimination and eradication. So for us, we work primarily on LF and onchocerciasis, as well as looking at NTD's integration and broader health system strengthening. Louisa, if you just wanted to say a little bit more.
Hi, thanks so much, Priya, and thanks, Marianne, for organising a fantastic conference. Really great to be here. As Marianne said, and Priya said, I'm Louisa Tribe. I'm the Director of Communications and Partnerships at Uniting to Combat Neglected Tropical Diseases. And we're a global advocacy organisation. We primarily work on resource mobilisation and advocacy for NTDs. A quick apology, as I won't be able to put my camera on today. I've had a severe allergic reaction, so apologies for not being able to see you all, but I'm really delighted to be here today. Thank you.
And Derek, as well, if you just wanted to say any additional introduction, and then we'll get right into it.
Not really, Priya. I'm just happy to be here. I think I'll just wait for my slot. A lot of you have already seen the work that we've done, and I think it's a good introduction to the work that can be done in the future as pertaining to advocacy and issues on educating the public on neglected tropical diseases. But thank you very much.
Wonderful. All right, then we'll get right to it, and I will turn it over to Louisa. We'll just talk a little bit about the backgrounds of World NTD Day, a little bit about this year's 2024 World NTD Day, and then, as Derek said, we'll go a little bit into that creative advocacy activation and talking about what's next. So Louisa, over to you.
Super, thank you so much. So just to provide a little bit of background and context, so World NTD Day has taken place on the 30th of January every year since 2020. And this date marks the anniversary of the 2012 London Declaration on NTDs. But in 2021, thanks to the leadership of the UAE, along with other member states, including Brazil and Oman, the World Health Assembly and the WHO officially recognised the 30th of January as World NTD Day. So it's really fantastic that World NTD Day is now one of WHO's official 13 global health days. And it was, as Marianne mentioned earlier, being an official day by WHO really brings a lot of benefits. It helps to drive progress on NTDs. It really helps to draw greater attention. It's a great moment, a great hook to increase political will, to reach public audiences, and really look at how can we kind of turn awareness, both build awareness, but then also turn awareness into action and resources which are critically needed for neglected tropical diseases. So each year, World NTD Day is an opportunity to both celebrate everyone working on NTDs, so the amazing people, the countries, the partners that are working on NTDs, but also look at how we can use the day for reaching audiences via increased media attention, and also building political attention and will. And also thinking about how can we therefore bring in new partners, new advocates, and reach new people to join in the fight for neglected tropical diseases. So I was just going to talk a little bit about the evolution of World NTD Day before we talk about 2024 and the creative activation. So just looking at World NTD Day 2022, this was a key World NTD Day, a key moment, which kicked off the Kigali Declaration on NTD's endorsement process. And this was really ahead of the Commonwealth Heads of Government meeting, where NTDs were on the global stage, and there was a major moment for resource mobilization. So at World NTD Day 2022, we had the 100% committed champions, including the Prime Minister of Rwanda and the President of Tanzania, who led an event to kick off the Kigali Declaration endorsement process, sign the Kigali Declaration and welcome other countries and stakeholders to do so in the lead up to the Commonwealth Heads of Government meeting, which was later that year in June, and where 1.6 billion commitments were unveiled. There was also fantastic creative assets and events from the WHO, and also, as is the case for every World NTD Day, numerous partner activations and events as well. So really, really great to see the whole community come together and use World NTD Day as a major moment for community engagement, awareness and activity. So looking then at World NTD Day 2023, so there was an aligned theme that all kind of partners and countries came together under, which was Act Now, Act Together, Invest in Neglected Tropical Diseases. And this was due to a report that the World Health Organization had put out just before World NTD Day, which had highlighted some major issues around resource mobilization and the need for new resources for neglected tropical diseases in order to deliver against the WHO's NTD roadmap. So this World NTD Day was really used as a hook to a kind of building out from the Kigali Declaration and the CHOGM event, using the day as a hook to announce new commitments. And it was great to collaborate with the World Health Organization on an event which numerous partners came to, and where new commitments were made, including from USAID, GSK, and ISNTD. And the President of Ghana also joined to endorse the Kigali Declaration. Once again, fantastic work from the WHO, and they had a number of events and different creative assets that the community used. And then also, we really looked at, going back to that point about increasing political will, we really looked at how can we ensure that country voices are heard and are the centre of World NTD Day. So we worked with the President of Malawi. He did a fantastic video message talking about the need to act now and act together, which was distributed. And then he also wrote an op-ed about Malawi's progress, particularly on trachoma, on World NTD Day again as well. So another example of just using the days as a hook to really kind of help build political will, hear from countries about the phenomenal progress that is being made in terms of elimination and control with NTDs. And once again, fantastic and numerous partners, activations and events. So I've put a link to the 2023 report in this slide. It's about 90 pages, which showcases so many different partners and what they did. Some really great and creative examples, including the N Fund that did an exhibition. I believe they're speaking a little bit later about that as well. So not enough time to talk about all the different partner activations and events today, but do take a look at the report to see the breadth of activity at all different levels, from community, country, to global. So I'm just going to hand over to Priya, who's going to talk a little bit about World NTD Day 2024. Thanks, Priya.
Great, thanks, Louisa. So for World NTD Day 2024, just I guess 4 months ago now, what we did was, together with WHO, the NTDs team there, Reaching the Last Mile, Glide, and Uniting to Combat NTDs, we started brainstorming, actually, I would say in the summer of last year, about a theme for World NTD Day, how we really wanted to ensure that we were getting as much consultation with the partners as possible. And what happened was we actually saw an op-ed written by President Mbalo of Guinea-Bissau last year, I think in July, and really was a call to action for leaders on the African continent to unite, act, and eliminate NTDs. And that really seemed to lend itself to a really wonderful overarching theme for World NTD Day. And so we adopted this, and it's the first time that the overarching theme for World NTD Day really builds on an endemic country call to action, and really builds on that country leadership and ownership. So following a few consultation processes over the course of, I would say, the last half of the year, so from around August through to December, we developed this campaign under Unite, Act, Eliminate, and within that, we recognized that we needed to have specific messaging or thematic buckets that related to some of the ongoing conversations in the global health and development space. I think one of our aims was really to link NTDs and position NTDs within other global health and development priorities to make those links a bit clearer, especially for some folks and leaders who may not have a good sense of the links that many of us in the community are well aware of. So what we did was we selected, again, through a consultative process, with the Uniting to Combat NTDs Communications Working Group, through the WHO regional offices, and also the NNN COM subgroup, a few of the buckets that you can see here. So equity, health system strengthening / universal health coverage, looking at resiliency and pandemic preparedness and response, global health security, climate and NTDs, and One Health more broadly, community and people-centered approach, Noma, because as we know and we heard, Noma was agreed as the 21st NTD, and then celebrating 50 down, 50 to go in terms of being halfway to reaching the targets in the WHO NTD roadmap of at least 100 countries eliminating at least one NTD. So these sub-themes then really set the stage for the assets that we developed. And what we wanted to do, and these were developed in English, French, Spanish, and Portuguese for this overarching campaign, was to ensure that they were evergreen, and really the idea being that these could be used throughout the year. Though you'll notice the World NTD Day branding is not on them, so that it could be used throughout the year and then linked back to any of those other thematic priorities that we mentioned, and have these assets that can be used by anyone for their purposes. Of course, because it's now an official WHO Health Day, there's the WHO website and official assets that were also used, and as well as numerous partner activations and engagements in country and globally. And there's so many, it's too many to go into detail here, but really this idea being that we wanted to ensure that assets could be utilized throughout the year and not just on World NTD Day itself. I will pass over to Derek now to talk about the creative activation.
Thank you very much, Priya. Thank you, everybody. I think my message is mainly focused on creation of the song Unite, Act, Eliminate. During the period of preparations for this year, together with the team of Louisa, Toko, Talia, we decided to create a song that appeals to the messaging of the current year, appealing to leaders, especially in the African context, and also trying to bring about awareness on NTDs, both in the tropical regions of Africa and sub-Saharan Africa as well. So we decided to do a song that also has a dance challenge. We looked at the languages involved, and obviously the major languages spoken in no official hierarchy were English, French, and Swahili, which are the common languages across Africa. So what we did was to then create the first version, which was only in English. We did translations, put it in French, in Swahili, and then we roped in Etienne Kasereka. I had to go to the DRC to record with him in the studio, and also then shoot part of the video there with the dance challenge involved in the process. So what we're looking at is, in the historical context of what we do in Africa, most of our history is detonated through poetry, through song, through dance. Those who speak the history of our kings even use the element of praise singers, or what we call in Ndebele imbo. Those are the ones who speak about the history of the king or the royal, from the ancestors to now. So most of our history is orally presented. Our culture is in dance. We dance when a child is born. We dance at parties, at graduations. It's a way of expression. And we dance when we're doing mass action or even demonstrating. We dance and we sing at funerals. So that is what the song was mostly around. So you find that in terms of response, we got a massive response, because what we then did is we also then incorporated influencers who are famous across Africa, but mainly from 4 countries, to then also do part of the challenge where they were. But you find that the challenge then spread across different spectrums of social media. You had the Gates Foundation doing it. You had Unite to Combat NTDs doing it. We had even main news articles on our national broadcaster ZBC. You had it all over the continent being broadcast. You had it on TikTok, the youngsters getting on board. You had different demographics as well, even the older generation participating. Why? Because it was simplicity. So the song focused on simplicity. It focused on a simple messaging structure for for the ordinary person on the street to understand it, but also for it to be able to appeal even to the higher echelons of the corridors of power, as far as political authority is concerned, because those are the decision makers. So I'm pretty sure everybody who managed to listen to the song or watch it on YouTube, I know Priya will play maybe a clip of it at the end, so that those who may have forgotten and need refreshing of the memories may be able to catch on board, to catch on to the song. But if you manage to see it, you see that the appeal was in its simplicity. You had kids, you had young adults, you had grown-ups as well participating in the challenge, because it was simple. So going forward, I would recommend the continued use of influencers in pushing the message forward, the continued dilution of the message from the technical aspect to putting it into a way that the simple man on the street understands what NTDs are and the successes achieved thus far in uniting to act and eliminate NTDs. So I think that's all I have to say for the moment. Thank you very much.
Great, thanks very much, Derek. And just to talk already, we're thinking about World NTD Day 2025, and it's only April of 2024. But we had some questions from members of the community about, how would we be thinking about the theme for next year? And some actually asked if we would be retaining the theme of Unite, Act, Eliminate. So there's currently a survey live to assess the direction for World NTD Day, the theme next year. We've had over 140 responses. We have the links there. There's surveys in English and in French, and we also have it translated into Spanish. And really here to understand how the community felt the theme provided flexibility or not. Were the buckets relevant for messaging? Did they use the social assets? And I think that big question is the one at the end of, should this overarching theme of Unite, Act, Eliminate be retained for future World NTD Day, certainly for World NTD Day 2025. And then we would identify specific thematic message buckets that would be relevant to the conversations happening. So this is the survey that is out right now, and we definitely seek as much feedback as we can from members of the NTD community, both in country and at the global level, to understand if this is something that resonates and that folks like. And I think that is it from us, and you have our contact details there, and certainly here to answer any questions. Thank you.
And thank you so much, Priya. I think Marianne's just got 2 short videos for us to play. That the first is of the song and the chorus that Derek produced, and then the second is just showing a wide range of different people. Amazing to see Dr. Moetti, to Gates Foundation, as Derek mentioned, to influencers and young people in Africa contributing. Over 1,000 people got involved. So Marianne, would it be possible to play those 2 videos? Thank you so much.
Yeah, absolutely. Here they come. That just instantly always brings a smile to everyone. I hope you really enjoyed that. What an amazing way to conclude the presentation about the World NTD Day, and that's wonderful news to hear that the theme may be continued, and this really impressive consultative process as well. So it certainly feels like a world effort. So thank you so much, Louisa, Priya, and Derek. Thank you. I think it's clear a star is born, and hopefully you'll remain a champion of the NTD movement for many years to come. Well, it's been an amazing session. I know in the chat a lot of our audience have congratulated the speakers for these amazing presentations, and then behind that all the projects that you've come to share with us. And we have run a little bit over our time, but we do have some time for some questions and a short discussion before we kind of wrap things up for the day. So if I could ask our speakers to come back on screen for a few minutes, if that's okay. Thank you. That's great. And anyone in the audience, if you had any specific questions, please don't hesitate to put them in the chat. But I think one of the things that really came to mind when we were hearing your presentations is this extremely careful process that you went through to decide which part and which parts you were going to bring to a story. And we heard sometimes that was inspired by Sofianu's father who wanted an image, or all the way to WHO who had a report, or even drawing from a wide range of partners. And so I was wondering, for anyone in the audience or any other groups who are embarking on a journey to communicate or create something about a disease, about a public health challenge, where should they take their lead from in terms of what to include in the story, where to start the story? It can feel overwhelming, I'm sure. So if you had any advice at all, and I'm not sure who would like to go first. Sometimes I go in order of presenters, but if someone wants to jump in first. Okay, Theresa, over to you.
Well, it's a very obvious answer for a first answer. Yeah, I mean, obviously you start with the people that are affected. You find out what's important to them. You find out what's real in their world, what's really, you know, what do they actually need? And often they haven't even thought about what they actually need. They're just struggling through the day. They're just struggling through, you know, avoiding attention, staying in the shadows. And I really liked hearing with the speakers, with Claire, particularly talking about the amount of time that she spent with building those relationships to get those authentic voices through. And I know, having local partners on the ground, for us, that's exactly it, that the HANDS team, the local HANDS team, know these people and they can really start to listen. And, you know, other champions then emerge as well, people that have the confidence to talk to you, then bring forward other people that are also affected and hear their story. So an easy answer from me.
Yeah, that was heard loud and clear, and perhaps we'll come back to that in a few minutes, but thank you, Theresa. Claire, would you like to add to this?
Yeah, sure. And yeah, I can only compliment what Theresa said. Yeah, I think it's all about time. I think it's not good enough to say that we want to hear from the people affected, but we also need to put a lot of effort, resources, and starting with time, which is obviously also a resource, to really build relationships. I think an important aspect of our work was also this perspective of coming back, not only asking people once or engaging with them once, but really giving people the opportunity to reflect afterwards. Some people, you know, Molcat, for example, was now started the first Noma Survivor Association, Elysium. At one point, she didn't want it to be filmed. This didn't prevented us from interacting with her, still spending time together, understanding the challenges she was going through at this time. And I think this is the result of all those positive interactions over time, which can end up with really producing content that makes sense at every level. And that this is reflected in the content and products that we are sharing afterward with the world.
Yeah, and a really good point there, to not just have affected persons involved at the start, but throughout the entire process, and certainly in the case of Noma and the work of Elysium over years, in fact. Louisa and Eric, did you have something to add to that?
Yeah, I would add, I mean, I completely agree with both Claire and Theresa. And I would add that it's really useful to also start thinking, the process thinking, why are you telling this story? Because I think storytelling is just such a powerful tool for change. And stories at multiple levels can achieve change. You know, we've heard about Claire's storytelling and how that led to Noma now being part of the official list of neglected tropical diseases. Phenomenal impact in terms of real, you know, change for the people that are affected by Noma. And similarly with Theresa's story, But I think, yeah, from our perspective, we also are looking at how can we motivate and inspire change at a political level as well. So when we're looking at stories, we're thinking about from a resource mobilization perspective, you know, what are the angles and the frames and the stories that will lead to donors or endemic countries or global funds or multilaterals, you know, committing resources for neglected tropical diseases, which are kind of ultimately needed in order to progress the agenda. So, yeah, I think fantastic to see storytelling at every single level. And I think Derek mentioned some really important points earlier as well around public engagement and keeping the message simple. Derek?
Yeah, thank you. Thank you, Louisa. Yeah, I believe in that. I believe in simplicity, and I believe in simple stories to tell very complex message, very educational as well. I believe every story has to have context. If you're speaking to, say, a white collar audience from Europe, there has to be a way that you tell the story that fits the narrative. And if you're speaking to below poverty datum line, African, you know, audience from, say, Zimbabwe, there has to be a way to be able to tell that story. So I think in every instance, you have to be able to tell the story in a way that that particular audience understands it. And just to give an example of what we did, the moment you include dance, the moment you include song, the moment you include very simple lines, unite, act, and eliminate, you know, unite, act, and eliminate, you've already done, I think, 3/4 of the work there. And then you add in the visuals, everybody sort of understands the work that's there. So yeah, that'll be my contribution on the matter.
Thank you, Derek. And also so great that the song is trilingual itself and just flows from one to the other. That's quite original and that makes it very special. So that's wonderful. We've talked a lot about the storytelling and that side of the equation, but what about the audiences? Do you find that over time, maybe since the COVID pandemic, or the way audiences listen to health, creative health messages, films, songs has changed? Particularly, Louisa, you mentioned the kind of political echelons. I mean, there was a rumor here in the UK that some politicians turned to the film, the Hollywood blockbuster Contagion, to kind of get some insights into what to do in a pandemic. I don't know if that's an urban myth or not, but have the audiences changed? Are they more open to these kinds of communications?
Yeah, I think they are. It all depends on how you package. If you package it as a song, as just a simple song with no hidden undertones of any agenda whatsoever, you then get the audience. But if you package it as say there's too much propaganda at times, you know, around some of these explosive issues. So if it's more like a force feeding method of do this, do that, it then becomes very difficult for people to accept it, because then they think, there's an agenda behind this. So in packaging the song together with you know, PR experts like Louisa and them, we were very careful how the audience would view the music or the song and the intention. So you find that it's more a celebratory song. It's not dark, it's not gloomy. It's not about an impending, you know, death of 1 million people, whatnot. But it more or less focuses on the gains made so far, and now in trying to explain what we could do further to, you know, sort of perpetuate those gains in the future. we then bring about a positive tone, which the theme of the year really helped on. It's very inclusive. It's if we unite, if we act, then we can eliminate. You know, it's not talking about how many people have died from this, but it's talking about how many countries have embraced the initiative. So I think messaging, I'll go back to the way you message is very important. If it's not gloomy, everybody is going to receive it because it's very positive. I think people are tired of, we are dying, we're doing, type of messages. They want something that they can celebrate even in the midst of any storm. There's the eye or the middle of the storm where it's very quiet and it's peaceful. So if we focus on those gains within the messaging, then it works.
That's true.
Derek, that's a really good point. So if it's a song, make a great song. If it's an image, make a beautiful image. And if it's a film, make a great film. And then the message will flow. That's an excellent reminder. And I know, Claire, you are very meticulous and very careful. Your images are always, I think everyone will agree, informative but stunning and very respectful. So I'm sure this rings very close to your heart, everything that Derek just said.
Yes, sure. No, I'm really happy to hear this point. It's a very good point, Derek, because this is what I tried to do with Noma. I think we needed to see things differently, to change the narrative, and not only focus on how terrible this disease is, not only focus on the part of the face which is destroyed by the disease, but look at the other part of it. Look at what's left of the beauty of people, what they were facing, but also what they wanted to achieve. And this is, indeed what the Survivor Association is doing now, or many more stakeholders who got involved in this movement, trying to focus on what we can achieve instead of what this disease is and the terrible consequences of it. Maybe something else, also just reflecting on your question about the audience. I have to say that our film, I'm speaking about the long form documentary, is not really talkative. It's more like an immersion in the lives of people affected. And it was quite interesting to see that we have been screening it in very different contexts, but people either from endemic countries or people evolving in decision making circles were all able to relate to it. And for me, it comes back to showing the humanity of people, and the fact that at the end, and this is something when speaking about including people affected, which is often interesting for me, is that it looks like there are the people affected and people who are not affected. No, at the end, we are all people. And for me, this is together that we can accomplish something and tell the story in the right way. So I believe a lot also into collaboration and the fact that, of course, you are building a communication product for a specific audience, but by also having this universal evergreen component, you can speak to different audience across cultural or language barriers.
Wonderful. Theresa, your organizations worked in disability inclusion for decades. Has the audience changed? How do comms get perceived?
I think the biggest change is the understanding of isolation and stigma that we got with COVID, because as soon as we thought as individuals that we had COVID, we were completely isolated. We were completely rejected by our closest family and friends, sent to our rooms. And that sense of isolation, I think the world now understands, really understands. Well, they don't have to face it every day. We get better or whatever. But yeah, that's really helped with the audience for understanding mental health, stigma and well-being in general. I think we can all relate to it. And, you know, these stories were always out there, but we understand them better now.
It's a really good point. Thank you, Theresa. Louisa, you're working with almost the whole spectrum of stakeholders, and you have vast experience in this field of communications. What are some of the changes you might have seen?
Yeah, I agree with what's been said, and I used to work on pandemic preparedness before COVID struck, and I think there's just a huge change in terms of how people understand the issue at a political level and at a public level, and the importance of health. But people have so many different priorities and things move on. So I think it's still critical. There's still not it's not necessarily translating into increased awareness around neglected tropical diseases as a specific issue. There's still that low level awareness compared to some other diseases and issues across the board. So yeah, I think, and it's interesting seeing some of the public polling as well, when people are asked kind of what they think government should tackle and care about. Things like issues around equity and issues around pandemics are a lot higher than they used to be like 5 years ago, 5-6 years ago. But we still need significant resources and action and awareness, and so I think it's a useful tool in terms of increased understanding of the importance of health. But yeah, it's not necessarily translated into huge change that is needed. So still a way to go.
That's good to know. Yes, still a long way to go. I think sales of books about infectious diseases have gone up a lot. There's certainly an appetite to know more, even fiction, non-fiction. So everything's working in the right direction. We did have one last question from the audience, which actually took an interesting angle on what we've been talking about. It's a question from Steffi Lowe, who's asking what the speaker's thoughts might be on disseminating locally research studies. So it's sort of the communications, but in reverse. For instance, is there any particular considerations compared to communications to raise awareness and calls for action? Is it different when the science needs to flow towards communities in endemic areas? I'm not sure who wants to tackle that one first.
I could just say it's part of our stigma reduction in communities to teach them where these diseases come from, how they're spread, what the transmission is. That is always part of it. But actually sharing these stories back to the community, I loved how, but all of you actually have shared it back with your communities. It's a hard thing to do sometimes, but it's really, really important. It shows that their willingness to contribute to that wider message, it reflects back to them, and it's helpful in their own communities to reduce that stigma through awareness.
And I would add, I agree with that, and I would add that the process of communication is really the same process, no matter kind of who you're communicating to in terms of the strategic process. So, you can start asking kind of, why are we communicating about this? Who needs to hear about it? And then you can go through a sort of strategic process of thinking around, what are your objectives and aims? Who are your audiences? How will you therefore reach your audiences? So that might be slightly different in a community setting to how it might be in terms of reaching others in other settings. And so then you think about what kind of tools and channels will reach those audiences, be it via community health workers, or be it via kind of radio, etc. So really thinking about how you reach them, and then how you'll know if you're successful or not with the evaluation and M&E piece. So it's the same sort of process, no matter kind of who or what you're communicating. You go through those sort of steps in order to create a plan that will help you reach those audiences and deliver that message that might be needed.
Wonderful. And Claire, I know for Noma, this will be a major component, just ensuring that, excuse me, communities are aware of symptoms and the progression of the disease being so, you know, like a lightning bolt. What have been some of your insights? Excuse me.
Yeah, sure. No, I mean, I can only agree with what has been said, and we have seen it with outreach activities and health promotion activities increasing, and indeed, I mean, not only being able to share those important messages about awareness and prevention or detection of the first symptoms with international audience, but also locally, and really tailoring tools for this local audience. And yeah, I mean, this is an important component.
Fantastic. And there's been lots of initiatives, whether that be using theatre-based skills, mobile film screenings, just all sorts of approaches, so which we have covered in past festivals as well, so lots of opportunities there. Derek, perhaps the final word to you. You've made a tool, you've made a song that reaches far and wide, so that's really one of the best examples we've seen, but anything that you've seen which may help to share scientific knowledge into communities?
Yeah, maybe to catch on to the last contribution about it being at local level. Whenever it's localized, it means you now have to deal with, because in as much as most of the challenges that we face or the issues that we face are broad-based, but each community has more of one neglected tropical disease than the other. So obviously you'd be focusing on that more. You also now have issues of languages. For example, if we're doing this year's theme song in Zimbabwe, say in Bindura or in Chimanimani, we'll be using the Shona language more because they identify more with that. Maybe a bit of English. And now the dissemination of the message, our leadership is more communal based with community leaders. We've got chiefs, we've got headmen. Challenges have to do with stigma and a bit of mythology around some of the diseases. You get it. You also have women being disproportionately affected more than men, you know, and kids in that instance. So it always have to be tailor-made for that particular community. But going forward, I think we have a good base. We have a good song. Maybe we need to now also bring in some of the more internationally renowned artists to come in, add in their voices, maybe a verse or so. We Are the World type of initiative would not be bad, provided resources are there. That's what happened with HIV, and you know, rate of infection and whatnot came down drastically. A lot of people are now on team. Stigma has gone down. So it's what I would encourage for us to go forward a bit more going forward. So that would be my contribution. I'm happy with the hands-on approach that the partners have played in creating everything that we have. I'm happy with the amount of resource mobilization. I do believe we have a great future if we incorporate some of the bigger voices. It will not be bad to have, say, Beyonce or Lady Gaga, or you know, some big artists doing the Unite Act, Eliminate Just a Verse, or even a dance challenge. It would totally bring a new focus on the messaging and a new audience taking it seriously.
That would be amazing. We will get there. Well, thank you so much, Derek. That's been really useful. Thank you as well to all our speakers. Unfortunately, we've come to the end of our 90 minutes, but I've really enjoyed the session, getting to know all your different approaches and tools and, you know, the song, everything. It's been really wonderful. And I know the audience is totally in agreement there. There's been a very exciting chat actually with some films, links to films put in the chat. That's what this festival is all about. And thank you, everyone. We heard a lot about co-creation and really putting the affected communities at the center of the stories, and also some very practical advice and tools on how to better communicate about local NTD issues and affected persons, and how to take that to the global stage. So a really excellent session. Thank you so much. A big round of applause to our speakers, including Priya, who had to leave a little bit early. Thank you to the audience as well. It's only the beginning. There are 7 sessions across 2 days, and later on today, well, just now in about 25 minutes, we'll be looking at art and health, the role of art in health, and science communication. There's also a session on data visualization, and really importantly and useful, the role of journalism in science dissemination, in communicating about NTDs, with lots of insights from journalists on also how scientists can tap more into journalists to share their research, and perhaps a few pointers by journalists of what would make their life slightly easier when trying to simplify all our very complex research for a broad audience. So lots packed into today, even more tomorrow. But for now, I will thank our speakers very much. One last big warm thank you from all of us. In the name of the festival, in the 20 or so minutes that are left until the next session, I was thinking of playing a few of the films that have been suggested in the chat. So for those who need to go, please disconnect. And for those who can stay, well, we will be playing Claire Jeantet's Inediz film, Surviving Noma. We've also had a wonderful suggestion from Mochana Roy Chowdhury, another film that was submitted to the WHO's film festival this year about fighting misinformation during a pandemic. So if that's okay with you, Mochana, I'll just play it here on the virtual stage. And also very kindly, Rabiu Ibrahim from the Female Genital Schistosomiasis Society of Nigeria has also played a film. And I think that will take us through the next 20 minutes or so, at which point I will see you in the next session. You should all have received a link. In case you haven't, I can always share it here. And on that note, a big thank you to our speakers. Louisa, I hope you get better really soon. We're incredibly grateful you still took the time to join us and share all those insights with us. So very big thank you, and see you all in a few minutes, hopefully.